All right. Good afternoon, everybody. Um, my name's Jeremy Smith. I'm the program director for the Iowa Navigator program. And so I've been doing this in partnership with Lisa and her team for several years now. And the reason we're doing it today is we're right in the middle of open enrollment for the health insurance marketplace. So really, we just want to make sure that everybody knows what your insurance options are for the state, and then know a little bit more about our program and how we can help, and then just kind of some important deadlines and just kind of how to navigate this whole system. So, um, I work for a nonprofit organization based in Charleston, West Virginia, actually called First Choice Services. And we specialize in social service and behavioral health helplines. So we do like the 988 Suicide Prevention Lifeline. We work these Navigator programs that help people sign up for health insurance, the 1-800 Gambler program for gambling addiction, addiction and mental health helplines for a couple states. So we're really good at kind of making it people comfortable and helping people over the phone. So, the Iowa Navigator program, we are an absolutely free grant funded service. We're funded through the federal government, through CMS, through the Centers for Medicare and Medicaid Services. And our kind of role in our lane is helping people navigate insurance options on what's called the health insurance marketplace, the Medicaid program, and the CHIP program for kids, also known as Hawkeye. So we sit down with somebody, no pressure. We're not running on commission or anything. We're just here to present all the options to people so that they can make an informed decision on these marketplace plans or seeing if you can qualify for state insurance through Medicaid or CHIP. So we first started this program in Iowa in 2018. Like I said, we're based in West Virginia. We've been doing the Navigator work here since 2015. But in 2018, we noticed that there was no local organizations that would even apply to do this work anymore. And because we're good at doing phone work and 800 numbers and that kind of stuff, we went ahead and applied, and we've been selected to be the Navigator grantee in Iowa ever since 2018. So, um, the funding and our services has kind of went up and down over the years. Last year we had in-person offices all over Iowa where you could come in and meet with us face to face. However, this year, due to funding cuts, we had to shut down our in-person offices, and we are back to helping just over the phone or virtually. Um, so I'll first talk about the health insurance marketplace. We're right in the middle of open enrollment for the marketplace right now. And so the marketplace is these are the plans on healthcare.gov. And these are private health insurance plans. These are companies that offer plans on the marketplace. And then most people that shop for insurance on the healthcare.gov, you can get a monthly subsidy. It's called the Advanced Premium Tax Credit, and it helps pay for the plan you've picked out based on your income and your family size. Um, we also, the healthcare.gov application can also screen you to see if you're eligible for CHIP for kids or Medicaid if you're an adult. The plans that are offered, the carriers offer a variety of different plans to pick from, bronze plans, silver plans, and gold plans. So kind of the difference is like the gold plan, it's going to be the most per month, the most your monthly premium is higher, but your deductibles and your co-pays are going to be the lowest. And kind of in reverse, the bronze plans are going to be the cheapest per month, but they're going to have those really high deductibles. So, like I said, these are private insurance companies that the Office of the Insurance Commissioner screens and makes sure they're legitimate. And before they can offer any of these plans onto the marketplace, they have to offer a variety of different plans, and they all have to cover what we call essential health benefits. That way, there's no surprises. So, any plan that's offered on the marketplace is going to have to cover these 10 things that I'm showing you here. So, hospitalization, emergency rooms, prescription coverage, lab work, that kind of stuff. So, that way there's no surprises when you're shopping for your plan on healthcare.gov. It's not going to be like one plan covers these things and the others don't. All of the plans offered have to cover at least these 10 essential benefits. All of the plans also offer free preventative care. So even if you get a bronze plan that's got those really high deductibles, if you have the plan whatsoever, there's going to be a list of services that are absolutely free. And those change a little bit from year to year, but it's really easy to Google search the list of free preventative care if you have health insurance each year. That way you can take advantage of these free services. So, who is eligible for a plan on the health insurance marketplace? So, you have to be living in the United States. You have to be a U.S. citizen or a lawfully present immigrant, and you cannot be incarcerated. Here's the big one. So, the marketplace is designed for people that can't get insurance through a job. So, if you work somewhere that offers you employer offered insurance, most of the time, that's what you're going to end up having to select. The marketplace is designed for if you can't get insurance through a job, Medicare, Medicaid, the VA, it's kind of an insurance of last resort. So if you work somewhere that doesn't offer insurance, or if you own your own business and you don't offer group insurance, then this tends to be a really good option for people. And like I said, kind of the linchpin in this whole program is that most people that get a marketplace plan can qualify for a monthly subsidy from the federal government that helps pay for the plan you've picked out. And the amount of subsidy you can get each month is based on your projected annual income and your family size and your age. So everything's going to be based on your projected 2026 income. Um, there's also based on your income, if you're below 250% of the federal poverty level, you can also get a break on your deductibles and copays. But that's only if you pick a silver plan. So when you're shopping for your plan, based on your income, that's going to be kind of how you make your decision when you're looking at all the plans and what you qualify for. So I mentioned that we're right in the middle of open enrollment. Open enrollment for the 2026 plan started on November 1st and will go until January 15th. If you miss open enrollment, for a lot of cases, you're not going to be able to get covered again until 2027. So it's really important to pay attention right now during open enrollment if you want coverage. A couple key dates. Anybody that wants their coverage to start as quickly as possible on January 1st, you have to enroll or re-enroll by December 15th. That'll ensure your plan starts on January 1st. Anybody that signs up between December 15th and January 15th, then your plan would start on February 1st. So, like I said, you have to sign up during open enrollment. The only exception to that is if you qualify for a special enrollment in the middle of the year. So, let's say you currently have employer coverage, but you know you're going to lose it in 6 months. Whenever you lose existing health insurance, that triggers a special enrollment period. Same for Medicaid. If anybody's on Medicaid and they lose it, that gives you a special enrollment period to still be able to sign up for a marketplace plan. So I mentioned earlier that the marketplace is only designed for people that can't get insurance through a job. However, there is one exception to that. This just started last year, and this is really important because it affects a lot of people in your industry that we've seen. So there's two things to look at when you're offered insurance through a job. There's the first option is it your job? And how much would it be just for you? And then there's also the option of how much it's going to cost for the family plan. So for instance, let's say you're married and their spouse's job offers you coverage. you're looking at how much the family plan would be. So in either case, if the cost of the employer offered coverage is more than 9.9% 6% of your annual household income, it's considered unaffordable by the government definition, and you can opt out and you can go onto a marketplace plan. So it's important if you're offered employer coverage, you want to know two things. You want to know how much that plan will be just for you, and then also how much it will be for your family. If it's affordable just for you, you're probably going to have to take it. However, your family members may be able to opt out and go onto a marketplace plan. So here's the companies that offer the marketplace insurance as of here in 2025. We you got four carriers. Couple of the carriers are statewide, a couple more are only in select counties. So there's a lot of different options to pick from. Several of these carriers and plans have been around for several years now. So a lot of different options to choose from when you're looking. Um, the other options for people I mentioned is the Medicaid program. And so Medicaid and CHIP is based on uh, monthly, your current monthly income. And so you can kind of look based on your monthly or your yearly on this. Um, Medicaid is over here in the blue. The CHIP program, it goes up to 300% of the federal poverty level. So a lot of folks can get coverage through one of those two programs as well. So if anybody needs help with any of this, like I said, we've lost a lot of federal funding and we've had a lot of layoffs, but we still have some appointments available between now and December 15th, and then especially after December 15th until January 15th. So if anybody needs help, the first thing I would recommend is figure out your projected 2026 income, your family income, and that's going to be your gross. And then also kind of come up with a list of your providers and a list of your prescriptions. And then we can kind of help you from there, fill out the application and apply for that subsidy, that monthly tax credit. And we can help you narrow in and help you figure out which plan may be best for you and your family. So, just to recap, when it comes to insurance options available to you, we've got group insurance offered through an employer, the health insurance marketplace on healthcare.gov, Medicaid, and CHIP. Um, be very careful where you shop for your health insurance. If you just Google search, there's a lot of fake stuff that comes up. So be really careful when you Google search for things because a lot of what they're selling online isn't legitimate insurance. It's what we call these short-term limited benefit plans. And that may be okay for some people, but you have to know what you're getting into. So just be really careful. The official website is healthcare.gov. Make sure it's that .gov. That's going to be the only legitimate website that I would recommend looking at. And then, of course, you can reach out to us, and we're happy to help people navigate through all this. So, again, here's our contact information. Um, Please feel free to reach out to us, and we will do what we can to kind of steer you in the right direction and get you through all this. Um, I'm sure that you've seen in the news with the government shutdown and talking about some of the changes to these programs. We have right now seen a little bit of an increase in the price depending on your income. It's more significant for some than others. However, there's still a lot of different plans to pick from. So we're really trying to help people dig in and still be able to find a plan that's going to work for you and your family. So we don't want people to go without coverage. So if you're not really sure what to do, please reach out to us and we're happy to kind of navigate you through this whole thing. So that was just a quick high level overview. I'm happy to take questions if you all have questions about anything. I'll just kind of go ahead and open it up. All right. Last call. Anybody got any thoughts or questions or comments or? All right. Well, if, like I said, if anybody needs anything, please reach out to us. Other than that, it's good to see everybody.